minus 16 minutes.
Inzaba lesibita nge-stigma and discrimination nako ukuthi bantu labaphila ne-HIV besekeleke ekuthatheni amaphilisi. So namhla sisukumisa i-patient literacy campaign lapho sithi khona sisonke sitiko letempilo netisebenzi tembuso ka-healthy nawo ke wonke umuntu lophila nemuntu lophila nalo ligciwane le-HIV lodle amaphilisi, kungaba singani sakhe, kungaba ngilashade naye, kungaba siblings latalwa nabo, kungaba nje ngumndeni wonke as a whole, nawo kumphakathi, the community laphila khona ukuthi inzaba libonakele ukuthi ifike ibe ngumthwalo kulena mbilo ukuthi labantu bethu ukhanza ukuthi nganye isikhathi abasakhona nekwathatha kahle lamaphilisi ngesigaba sokuthi kwekuqala kwananabo abakademukeli ngalokwanele kulena mbilo nekokuthi ke labanye batemukele ngalokwanele kodwa ke abesekeleki ngalokwanele. So namhla simele baleni sitiko letempilo sithi nasikhuluma nge-patient literacy sisekela lena mbilo yabantu labaphila nesifo segciwane kakhulu emkhakheni ukuthatha amaphilisi ukuthi abawathathe ngendlela ngalo ukuthi sithine lesiphila nabo sibakhele environment levumayo ngokuthi baphile bangacwayeki, baphile bangadiboni behlukile bona kunathi. So ngikubemukela ngokuthi sime nabo ngikona ubuka nje la emva kwami nobuka kubhala ukuthi I stand lena inzaba ukuthi sine lesiphila nabo sima nabo, showing ngesingisi kubitha nga empathy as opposed to sympathy. Show ukuthi nasisima nawo, show ukuthi we identify ourselves with what you are, who you are, nokuthi uphila yiphi impilo. So that is the stand that we're taking today. Lenzaba lena lesisukumisa namhla itawusebenta tingoni letinyenti kuyo inzaba yekurespond ku-HIV in the whole treatment cascade. Takhumbula ukuthi live lakithi selifike esigabeni la lifike lathola lifike laphumelela esigabeni sokuthi lente 95 which was i-target emhlaba wonke jikelele lebebekwa ukuthi sifike ku-2030 but nesilive sishaye 10 years before. So nasithi 95 sisho ukuthi 95% of the population yalelive like isikangwane sebasathi isimo sabo sengadi uma sifika sikhuluma ngenzaba ye-HIV nokuthi ke 95% of them bakhonele ukuthi bathathe amaphilisi, 95% of them bakhona futhi kufika esigabeni se-viral suppression. So but now ubuka leyo treatment cascade kuyakhombisa ukuthi kukhona tikhala litifaka khathi labancane bethu, adolescent and young women nalabasha bethu bobhuti nabo bashoda ngemva. So le campaign lena itargete lelo hlobo lwabantu ukuthi besekeleke njengoba tinombolo tabo nathi tibala tisalela ngemva. So sesike sukuma nabo namhla noma ke sima nabo sithi we stand with them as a community. Nasi nje lokusila sikaze ukuthi we are just not here for interviews but asiphumeni siyosebenzela lenzaba ukuthi umuntu lophila negciwane simesekele abe ingcenye yethu. Lenzaba lena ke sitayisebenta emsakadi ngokuthi sisebenze sifake tonke tigaba ekhathi itawungena ku social media, itawungena futhi in printing media, in printing itawungena futhi nakini nje emsakadi tithombe sawusenda nema SMS kuma social media nayo indlela ukuthi abantu bakhusadeke kulena mbilo kubheke embili. Sithemba ukuthi uma lokusisukumisa namhla itasiniketa sivuno lesitasithokotela silive sonke lapho kutawuncipha khona abantu labangasathi nalesimo sengade yabo ngoba vele seloku satest but ikhona ingcenye lesayidinga ukuthi nayitest lesilo kanza ukuthi indlela sithe asiyithola but sithemba ukuthi abantu batawukhutha itasi le environment ngekuvuthwa wonke umuntu utathi khanza kulula kusahamba ohlula simo sakhe sengadi bese kuthi nalabo labadle amaphilisi sekubalula ukuthi bawadle ngekukhululeka hayi ngokwafihla. Ukhanza labanye bethu sebafihlile omnye wakho ohla yedwana ngoba uhamba yedwana kulolu hamba namhla sisihamba nani sihamba kanye kanye bese kuthi ke egcineni konke sikholwa ukuthi eMaswati atawu achieve what we call viral suppression. So ukuthi atawukhona ukuthi kube bede tifo lokhanza ukuthi tiba mathabela ngodi ngokuthi amaphilisi abantu abawadli kahle sikubita nge-advanced HIV disease noma opportunistic infection. So namhla sithi nje siMaswati isitiko letempilo sisukumisa lo msebenzi lo faka ekhathi sine sonke ngetinhlelo tethu.
Ya kuyevakala kakhulu Nkosi, sithemba ukuthi umbukeli ulithola kahle wonke umlayeto nencazelo yalomsebenzi walomhla. Mhlambe Nkosi lomunye utati buta ukuthi ungabe yini le bayibonile vele kuleto tikhebesi nje mhlambe ukuthi kube kubili kube kuthathu Nkosi.
Okay, lesisebenta ngako ka HIV response noma HIV management. Sisebentisa tinombolo. Sikubita ngalolu lwethu sithi i-data. Sinetinhlangothi nje tabo M&E. Leti nombolo sisebenta ngato kakhulu kangangokube ngito letisitshelayo, ngito letikhipha what we call indicators ngokuthi kufuna sisebente ini sisebente kanjani. Then bese sihlala phansi siyabukisana. So uma sikhulumisa 95 kutholakala ukuthi labasha bethu, adolescents and young people, they are not as everybody else basilele ngemuva. Kufaka nabo babe nabo basilele ngemuva, basilela ngemuva. Ikhona ke nalethi zabantwana kodwa ke nje sisinamhla siyisukumisa sifuna kuvala letho khebesi nekwekuthi ke sinalo hlobo lwebantfu labase sa default emaphilisi. Sethemba ukuthi sikhuluma ngepatient difference kutaw ayina tonke letindzaba lethu. Kukhona abantu abasesemaphilisi bawayekela, sesemaphilisi bawayekela ngetizathu tabo. Lokubanga ukuthi bese sebakha lenye indlela yalomkhuhlane ukuthi usihlasele sikubita nge-HIV drug resistance. Loko kuyingoti, so kufaka live na wonke mlosita kulesimo lesikokuthi bese sokutinweba ngalokwengcile ukuthi kuyofuna ama drugs lamanye ebonisa ukuthi etanetindaba nekudula kanjalo njalo. So bese bakhona indzaba ukuthi nalabanye futhi labatholakele ukuthi bayawadla amaphilisi batholakala banetifo lesibita advanced HIV disease, batholakala banabo meningitis lokusifo lokhanza ukuthi sibatsinze engqondweni, batholakale banabo TB, batholakale bana midlavuza. Lelo nombolo leto tibangela ukuthi kule treatment cascade kunebandla singahambi nabo. So namhla nasukumisa lenzaba ye-patient literacy December ukuthi itachibela letigaba nganga lethu sitawubona leti nombolo tebantfu sikubita ngalumi lethu sithi attrition. Leti nombolo lethu tawedla which is tinombolo letkulu tebantfu what to call loss to follow up, nombolo tebantfu labayekela nje treatment. Sithemba ukuthi titawehla ngekuthi live lonke na wonke mlotsinzeka empilweni yemuntu lophila nesifo se-HIV utawutsinzeka ahadla lechaza lakhe impilo ibe ngcono yemuntu lophila nesifo se-HIV.
Siyabonga kakhulu Nkosi, sithemba ukuthi babukele emakhaya niyachubeka nisilandzelela njengoba siyawube sinethulela bukhoma lo msebenzi kiyo umsakato ichannel Yemaswati. Sibonga kakhulu ithuba lo sinike lona Nkosi, sisithemba ukuthi Yemaswati sakhanyiselekile ayawuthalandzela nje umsebenzi la kuningi lesekukhanyile manje ukuthi kahle kahle ingcikitselo umsebenzi yini. Ndawuthatha inzambo ngitiphose muva etulo eMBABANE. Ngibonga kakhulu uZandile Mpapane, ngithemba ukuthi ihlelo liqhubeka kahle lapho sivukile eSwatini kusile Maswati lamahle.
Asibonga. How was it?
Health literacy is about making informed decisions and taking actions to promote and protect health. Health literacy is the degree to which individuals are able to access, understand, evaluate, and communicate information to engage with the demands of different health contexts in order to promote and maintain good health across the life course. Research shows that health-literate patients are more able to make healthy lifestyle choices, have better communication and interaction with healthcare providers, access information and services, manage chronic disease, and engage with health, education, and promotion. Health literacy is also a way to promote, maintain, and improve health across the life course. And health-literate partners consider the role of health literacy in helping patients access, understand, evaluate, and communicate information, resulting in increased effectiveness in treating patients, better patient relationships and communication, and increased efficiency of the entire healthcare system, both public and private. How many Canadians over the age of 16 do you think have low literacy? And what percentage of Canadian seniors have low health literacy? This means that the majority of your patients and clients leave your appointments without understanding what they've been told. Health literacy is a costly problem that will grow as the population ages and chronic diseases increase. Dan is among the 60% of Canadians who do not have the health literacy skills needed to adequately manage their health and healthcare needs. He is 24 years old and his asthma has flared up again.
You say for rainy day, we provide for the future.
Mama always told me everybody needs an umbrella for a rainy day. A little something you could put away. A bit of patience goes a really long way. And with these seeds I carry hopes of better days. Whose fruits are these anyway? Wait a minute, okay I get it. Live for today but prepare for the future. Make sure you cover your welfare is crucial.
Okay. Hayi kuhamba kahle kakhulu tsatewethu la endaweni se-Hilton Garden Inn eMbabane. Sebaqaleke nekufika abantu labadzala abatawungenela lo msebenzi kude utoqhubeka uqale. Sitawuqala nje ukuthi madodana njengoba ngithembisile ukuthi sosive siyawube bathumelela bukhoma lona msebenzi noma ke tonke leto thombe lesiyawube siqhubeka nato khona lapha endansi kubekisa nje kulabanye lebakhona lapha endlini ukhona lo ngumqonzisi jikelele wayo ke iNature babe Khanya Mabuza siyambona naye dokotela Buthelezi naye dokotela Velepe Okelo siyababona lababuya ka Elizabeth Glazer nguye ke Mr Yende lo kufaka ekhathi nalabo labaqhamuka etikweni letempilo ma officials nabo ke labaqhamuka kiyo ke iFaith and Community Based Initiative siyathi ke ukuthi sike sabamba imikhankaso nabo cishe ke tonke inhlangothi lesibuka ukuthi dibuke yona imkhakha yetempilo bakhona balapha bakanye nathi ngibo ke labayobe baqhuba kabandi lona msebenzi bengosi lesibona ukuthi ngiyo i-Patients Literacy Campaign lelapho avetile kabandi Dr Advocate Dlamini lapha ukuthi cha umkhankaso lona lo kubonakala ukuthi eMaswati kufanele aqhubeka sokumise luhlelo lokubambisana kuniketana lusito nanoma abantu baphila nayo HIV bangecwayeki bakhuthatheke ukuthi bathathe leyo mithi yabo ngendlela lefanele kude sonke sive kutawubonakala ukuthi siyakhona kumelelana nanasi isifo se-HIV kuse madodana nje ngifise ukuthi ngikhulumisane nabo bantu labadzala la ngekhathi endlini njengoba kubhekele ukuthi nanoma ngabe kunini nje nginganiketa yona i-interview leqhamuka kibo ke bantu labadzala njengoba sibona ke ukuthi baphelele lapha endlini lihlelo ke lisengaqali eMpapane kepha ke ukuthi madodane litawuqala njengoba basaqhubeka nekutheleka ngedinombolo dabo kude kuthi umsebenzi uyawuthi uqale lokho ke sitawuvanga ngako njengoba luhlelo seluvele ke lumenge ngumumo njengoba ngilokuningi kuyalungiswa ngakhona ngalapha le ngethemba ukuthi njengoba kuqhubeka ilanga nje eMaswati awuniketeka kabandi ke umsebenzi lo yawuthi kubonakala ukuthi sichuba yona ke i-literacy campaign ngalo luhlelo lapha ke ngidawuvele ke ngikhulumisane naye tsatewethu la lengicabanga ukuthi utasiniketa naye ke umlayeto lokujulile kabandi ngalomsebenzi walomuhla le kubonakala ukuthi sisemakhaya sibukhoma sivusele tsatewethu sicela usethulele libito nesibongo nekuthi uqhamuka kiphi inhlangano nekuthi ndawesekela kanjani nini lo msebenzi lomuhle.
Angibonge kakhulu mina kethu nginompilo ngakagwebo ngisuka etiko letempilo umsebenzi lesibhekene ngawo namuhla solo sikhuthatha eMaswati lasaqalile kuthatha amaphilisi ekuthinthibeta ukuthi aqhubeke nekudinakekela nekukhona ukuthi banathi amaphilisi abo ngendlela lekahle kepha ke kulokuhlangana kwanamuhla sithe asesikhuthathe bantu bethu labasha kanjalo nabasifazane lasebakhula khulile nebesilisa njengoba sathi ukuthi ekuphileni akusithi sonke asimo asibi asifani nanoma somdzala kepha nje ke kubuka inombolo deliver iyakhombisa lokho ukuthi bantu bethu labasha baba abantu labaliqala kololihlelo bese sokhanza ukuthi emva kwesikhathi akasabonakala ekudinakekeleni so lokho ke sikwentele ukukhuthatha lawo Maswati ukuthi noma ngabe tikhona leti ngcinamba thide abawusebenzisa umtholampilo bakhona kufinyelela nekuthi bathole lwadi nekwati ke ngoba siyati ukuthi sikhuluma ngakho kuthinta kakhulu naleti indzaba lesithi kubhoboka kumlomusha uyabhoboka namhla but ungakutholi kusekeleka sifuna ukukhuthata naloko ukuthi uma semuntu asabhobokile ngesimo sakhe asimkhuthateni futhi singabe sesokhanza ukuthi siyameneka lena nalena kepha kube nalo hlelo lokuthi ukhuthateka kanjani nemango kusamukele sibantu labaphila neligciwane tinhlelo letikhona atibe ngiletikhona ukuthi banabo batikhanze bemukelekile kwathi ukuthi uhulumende wakithi nasaletha lo hlelo emangweni lekuthatha amaphilisi babe bantu laba khonako kuya khona ngaphandle kokunceneka ngoba sekuba nalokucwayana sekukhonjwana ngetinhloko so kukhuthatana lapho nje ukuthi kuloyo losawaqalile achubeka wathathe ngekwethembeka nangabe kunedingcinamba tekubhoboka akawusebenzisa umtholampilo kusitakala umango awente tinhlelo lotokhona ukuthi tisekele abantu labaphila negciwane ikakhulu insha yethu.
Siyabonga kakhulu Gwebo cishe ke soyivete yonke sithemba ukuthi njengoba sachubeka umsebenzi uyawubatha udane sizawuhla sekuthinze nje ukuthi cha sicela ke usicacisele ke kunako ukuthi singabe nyalo njengoba lihlelo lapha konke kusho ukuthini.
Asibonge kakhulu.
Siyabonga kakhulu. Sivile ke Maswati lamahle ukuthi lo msebenzi uconze ukuthi uchubeke ke usesekele luyaqala ke lihlelo nyalo ngone lomuhle ngiyawuvele ke nami nyalo tinsambo ngitibonakalise ukuthi ngidiniketa loyo long program director walo lihlelo dokotela advocate Nkosikhona Dlamini le ngithemba ukuthi mlangeni ungasonzela lapha kuyo ipodium utochubeka ngosi na umsebenzi njengoba kubonakala ukuthi livele lihlelo seliyaqala la bekunene sibukhoma lapha emsakatweni channel Yemaswati na online sithemba ukuthi niyachubeka nilandzele umsebenzi usachubeka kulesikhathi ngitawuvele ngithule lihlelo naye Dr. Advocate Nkosikhona Dlamini la nguyeke lo yawuthi aqale lihlelo kusukela nyalo kuya embili Nkosi sibonge kakhulu sinita tinsambo ukuthi mane uqhubeka lihlelo nase siyawulandzela khona lapha.
Sibonge kakhulu umsakati sibonge nakuyo umsakati wetithombe channel. With all protocol observed, Director of Health Services, Deputy Director, Clinical Dr. Okelo, Deputy Director, Public Health, Margaret Joyce Ngambule, PEPFAR representative, country directors, and all distinguished, including also the INAP, colleagues, the media houses. Ladies and gentlemen, good morning. Before I proceed with this beautiful moment that we have today as the Minister of Health, I would just like to start with a word of prayer. And I'm going to just give Nobushan Chetu to give us a word of prayer this morning.
Good morning, everyone. May we bow our heads. Heavenly Father, this morning we come before you as we are about to engage ourselves in this activity of the patient launch, the literacy launch. We ask for your guidance. We ask for the spirit of understanding, wisdom, and knowledge so that we can proceed with this gathering and our people get the literacy that they need about living with HIV. In Jesus' mighty name, amen.
Amen. Thank you very much, Nobushe. We want to take this time. I'm the director of this program today, this morning. My name is Dr. Advocate Nkosikhona Dlamini from SNAP, from HIV Care and Treatment, the Treatment Art Coordinator. We're so delighted this morning to have this very, very important moment, both as Minister of Health and also as INEP and all the partners that we work with in the fight and the response on HIV. This morning, I want to just share with you just a brief before we start running down our program. And I want also just before I proceed and also recognize Babekhanya Mabuza from Nature. Siyabonga Mabuza, siyabonga. We want to start and say that today we're in an event, we're in a moment where we are about to commission what we call patient literacy campaign. But I'm not going to just unpack most of the content. We have the guest speakers who are going to just hit and name the subject accordingly. But just my portion this morning is just to give an overview of what we call patient literacy campaign. Generally, in terms of response to HIV as a country, from the beginning of years that we had as a journey as a country in terms of responding to HIV, one of the components that is very, very important is what we call patient literacy. How is so important? It is important in the sense that the people, particularly the recipient of care, but not just only them. It has got a lot of other people that are involved, including even us as healthcare workers, on how we deal with the subject of HIV response, even including our communities and our families. So this morning, we just want to share with you that also, in terms of HIV care and treatment, as an office itself, we want to appreciate this dimension today of commissioning what we call patient literacy, because you know that as a country, we have done a beautiful mileage where we have achieved what we call 95, 95, 95. 95, 95, 95, which is to say 95% of our population as a country, they know now their HIV status, and 95% of them, they've been enrolled into antiretroviral therapy, and also 95% of them, they've achieved or they're able to do what we call viral suppression. However, we still do have, in terms of analysis of our data, that we do have some gaps, which one of them, it has to do with our adolescents and young women, and also men are part of the population that is a little bit lagging behind, which is to say, today we were responding by virtue that we are supporting a move to this dimension, to making sure that everybody is able to respond accordingly. So this morning, I want to say, we believe that as this patient literacy campaign is going to be commissioned this morning, it is going to just be calling everybody to play his or her role accordingly so that we achieve and close the gaps that have been noted on the ground. You know that in terms of HIV care and treatment, we do have elements of HTS, which is HIV testing. We still need to support that move. When we talk about patient literacy, we believe that after it has been done, it has gone deep down to the roots, and everybody is involved, the environment would mature up, and all our people will feel supported that they can easily just go and do what we call HIV testing. And even those that are taking medication, that are enrolled on treatment, they will be able to take it confidently without element of what we call attrition, which is what we call lost follow-up. Also, some of us who stop taking medication, defaulters and what have you, which then create another problem under the response of HIV response. So where you find that eventually dimensions of HIV drug resistance, we start seeing them along. So we believe that we're also going to just reduce numbers of people which now we found to have what we call advanced HIV disease, which is cryptococcal infection, TB, cancers, and what have you. So we believe that once this has been launched, it has been rolled out, and all we're playing our role, including our communities, our families, our friends, we're going to achieve and close the gaps and be able to hit our next target, which is 100-100. With those remarks, colleagues, ladies and gentlemen, this morning, I want to just share with you that how much we're excited as the office and through the manager of INEP, we're excited of this campaign because it's going to assist and support us in the move as we respond to HIV on the ground. Otherwise, in terms of the program, those are my opening remarks as I lead this program. So the next speaker that I want to bring on the podium this morning, it is one of our own who is what we call a recipient of care. Please, can we welcome Ms. Futisho on the podium for them to share their remarks as part of what the recipient of care population is concerned. Thank you very much.
All protocol observed. I thank you, Dr. Advocate. My name is Precious Shaw from the Swaziland Network of Young Positives, which is a network of young people that amplifies the voices of young people living with HIV in ensuring that the space is conducive for young people living with HIV and affected by HIV to partake and engage in. We would like to first appreciate the government of Eswatini as recipients of care in ensuring that people living with HIV in the country have enough ARVs so that we ensure that we have retention to care. We have seen, if we can go a little bit back, we can remember in the early stages of HIV that having treatment at a particular time was a little bit difficult. We remember the comrades that died during that time when we still had to buy ARVs from the pharmacies. But at some point we got to a situation where the government ensured that people living with HIV have enough drug supply. It has been quite a very long journey. We have had a situation where we had treatment that had very huge side effects, where at some point some of us faced a situation where even our body appearances changed, where some of us had a fat displacement. But as people living with HIV, we have managed to thrive up until this far. We have noted the support that we have gotten from the PEPFAR in ensuring that people living with HIV have enough drug supply with the Global Fund. We really appreciate those efforts in working together with the Ministry of Health and Nature from Eswatini. I would love to really appreciate the Office of INAP in ensuring that young people living with HIV have been part of this initiative of the Patient Treatment Literacy campaign from the inception, where the young people have been engaged in terms of developing the messages that we see here today. As we are going to see them in some of our leaflets, the posters, the billboards. And when we are talking about youth engagement, this is where we have really seen the meaningful engagement of young people, where they have said what they want and how they want it. Moreover, we have noted the meaningful engagement of adolescents and young women living with HIV. I think we all have seen the statistics in terms of young people and adolescent girls and young women in terms of retention to care. That as much as we have reached the 95, but we still have to put a lot of efforts in ensuring that young people in general and adolescent girls remain into care. And we really appreciate the fact that they have been part of this process. We would also love to appreciate the fact that we have seen a tremendous change as people live with HIV in terms of the treatment that we are currently using, which has got a little bit which has got less side effects, which makes it easier to consume as people live with HIV. Not only have we seen under the adults, but we have also noted the introduction of the syrup for DTG for children, which we really appreciate as a network of young people living with HIV. On behalf of people living with HIV and women living with HIV in the country, and IGYW would love to say to stakeholders that are present here, the Ministry of Health and Government, that we support the campaign that is here, where we say #ISTAND. Like we are committing to ensuring that young people, adolescent girls and young men continue in staying into treatment. And as a network, we are working together with the ministry and the different stakeholders in ensuring that there is retention to care amongst young people, adolescent girls and young women living with HIV and the general population of the country. And we would love to urge all stakeholders who are present here that as we work with people living with HIV, we should also remember that people living with HIV are not just numbers. But we go through a lot every day as we try to stay on treatment and ensuring that we stay healthy. It is a journey. We take it each step at a time. There are a lot of challenges as we take it, especially when we are going to look at the issue of young people, that they're transitioning from being adolescents and being young people. So there are a lot of challenges. That's why we're having issues of adherence amongst that particular group. I will make an example. Some of them are still in school and they still want to feel a sense of belonging. And some of them, we can note that they're at boarding school, where you have to start opening your treatment and where you have to feel a little bit different than anyone else, because at a certain time you need to remember that you have to take your treatment. So as stakeholders, we all have a role to play in ensuring that the environment is conducive for young people to make sure that they take care of, they take their treatment each and every day. But just to emphasize that we are doing everything that we can as young people living with HIV, that young people, adolescent girls and everyone is able to stay on treatment. Just to say today, we are happy to say we support the ministry, we support the government, and we are very excited as young people. We are going to be taking this campaign a little bit further, where we are going to be doing dialogues at community level. We'll be going live on social media, because that is what young people are known of, in ensuring that we encourage and we reach as more young people and general HIV in general. I thank you.
Thank you very much, Futhi. That is a recipient of care. And this is an amazing feedback. You know, when you are working and pushing on the ground in terms of HIV response, such kind of people, in terms of recipient of care, they're important to give you the feedback of how are they receiving our care. On that moment, I will take this moment, colleagues, ladies and gentlemen, with all protocol observed, to welcome on the podium again remarks from nature. Mr. Makanya, let's put our hands together. It's welcome. Kanya, my apologies, Kanya. Let me.
Yes.
Please bear with me.
That's fine.
Yeah.
Okay. No, thank Dr. Apologies accepted. My name and the surname are almost the same, Kanya Mabuza, so I accept what. But Kanyi, okay, I'm not Kanyi. Colleagues, it's a good afternoon, it's good morning. I think it's afternoon because we're here earlier than other people. Let me observe the protocol. Firstly, Director from the Ministry of Health, Deputy Directors, Margaret Joyce, Dr. Okelo, OWAC, Dr. Abtelezi, and the partners, Margaret Sharel from PEPFAR, and all other partners that we are working with. People living with HIV, Margaret Futhi, we really appreciate. The media, colleagues, ladies and gentlemen, it's good morning. I'll be making very brief remarks, hence I preempt other speakers. Mine is just to really thank the Ministry of Health and the partners, particularly the American government, for such an innovative campaign at the right time for a good purpose. I'm saying that because we're at the moment in the HIV response whereby we need really to put or exact the last effort. We are being challenged from the HIV front by many demanding issues, both globally and nationally. Yesterday, in the UN Assembly, there was a session on HIV, and all the partners were presenting. And I was marking, it was at night, at around 9, I was highlighting the issues that they were raising. Everybody was mentioning the issues of external aid funding, which is an issue. And everybody was talking about fatigue with this epidemic, which has been with us for 40 years. But on the other good side, people are also talking about the achievements that we have made in the HIV response. So I'm saying this, Director, because I believe that if we are not exerting more effort on treatment, we may not be able to reach the 2030 goal of the UN. So I really want to congratulate the Ministry for such an innovative campaign. I strongly believe that knowledge is equitable to meaningful behavior. So likewise, cause of lack of knowledge amount to undesirable behavior. I'm saying this because we have been faced as a country in the mid-2000s, I think those who were there, particularly Bomagere Joyce, will tell you that the spikes that we saw in HIV were primarily driven by lack of proper knowledge on HIV. But when we started to meaningfully invest in awareness and knowledge, in-depth knowledge, we saw the control of the new infections. Now we are in the other cadre of the uptake of services, primarily treatment. With treatment, every day we are faced with challenges, misconception, misinformation about drugs and treatment in general. So one hopes that with this campaign, we will be able to meet and readdress such misconceptions that seems to be prevailing in our days. The government of Eswatini is currently conducting a midterm review of the National Strategic Framework on the multisectoral HIV and AIDS. It is our hope that we'll be addressing some of these critical issues. Yes, we appreciate, Dr. that we have reached the target of 95, 95, 95. But it's high time now we do a further in-depth analysis about this 95, 95, 95. We have other subpopulations that are left behind. We have people who know their status, but they're not on treatment. We have people who are on treatment, but they're not virally suppressed. Yeah. So then there's a missing piece in the puzzle. And I believe this campaign is going to address that. With that, let me conclude by saying nature fully supports and appreciates this campaign, and we want to confirm our support, continuing support to the campaign for any other thing in additionality to what has already been designed. So we'll be standing with the ministry in this campaign. With these few words, ladies and gentlemen, once again, thank you and congratulate the ministry for such a campaign. Siyabonga. Now, what's I'm coming aside? Manje, some of these things are said by fans. Ngicabanga ukuthi ngeku dithoba lokukhulu nje kusho ukuthi siyabonga kakhulu ukuthi sisuka umsebenzi onjengalo. Lo msebenzi onjengalona ufika ngesikhathi lapho sisive we are face sihlangana inkinga enkulu ngenzaba i-HIV ne-AIDS. Now uva nje bakhuluma cishe abaningi ikakhulu labasita ngetimali basichasa silive. Inkulumo lenkulu ukuthi umhlaba ubhekene tinsayeya ikakhulu tindzaba te-COVID nayetinye tindzaba tikhona. Ngako ke nasibuka timali ngeke tichubeke tibe khona njengoba betikhona nje. And lokunye futhi lesibuta kona sinesebenza bate AIDS kwekuthi lokhu HIV AIDS cishe seyiminyaka ihambile. Cishe sohlamsa iminyaka lengemashumi lamane nyaka. sitawuqhubeka kanjani ne-HIV. Kungilapho-ke sidinga ukuthi sihlale phansi sibuke ukuthi thina silivela kangwani, sitawusebenza njani. Kodwa-ke sengikushilo lokho, ngifuna ukusho ukuthi i-HIV isifundisela okuningi, futhi kuningi ngathi sikuzuzile kule minyaka ledlulile. Kodwa-ke sekumgcoka lokuthi sibukete ukuthi singenda njani. Ngifuna-ke ukubonga kakhulu lo mkhankaso losukumako namuhla, lapho sibuka khona ukuthi singafundisa njani ngekuthi sive sati kabanti ngemaphilisi lawa ukuthi sibalisa i-HIV. Lokhu kufika ngesikhathi simgcoka lapho sibona khona ukuthi bantu labaningi abadi kahle, futhi siba namibuzo zayitfolako njalo nje ube ukuthi umuntu ubuta ngaleli philisi lelo, umuntu uhlaba la angadi ukuthi kusho ukuthini lokho. So siyabonga nje kakhulu etikweni letempilo ukuthi usukuma lo mkhankaso, and sinengikholelwa ukuthi lo mkhankaso lo utawusita ukuthi vele ngeminyaka wa 2030 sibe sesicede nya indzaba ye-HIV. Siyabonga kakhulu. Thanks.
Awasiphindze sishaye tadla sibonga inkulumo lehle kangaka kumshengo nekwemukela ukuxolisa uphambathisa. No, siyabonga kakhulu. Luhlelo lusaqhubeka kanje. As we proceeded our program this morning, we recognize that our media houses, they also appreciate our Swati. So our mix. Ngiswati lemthabo bangwane ngethusa kama advocate. Nelibala lami lesikhumba bahle bangifaka eZimbabwe bangifaka eNigeria. Ngiliswati lemthabo. All right, at this moment, with our protocol observed, please, I'll call to the podium for remarks from PEPFAR. Sitawuthatha lethuba semukele inkulumo letayethulwa ngilomele PEPFAR Evan. We want to take this time to welcome you on the podium. It's a time to make remarks. Thank you. Okay, it's a fresh one. Yes. Thank you.
Thank you. Good morning, everyone. My name is Cheryl Amoroso. I'm the PEPFAR Country Coordinator here in Eswatini. Just want to start by acknowledging the Program Director, MOH Director of Clinical Services, NRCHA Director, senior MOH officials that are here today, the recipient of care representative, and all people living with HIV, implementing partners, civil society, distinguished colleagues, media, ladies and gentlemen. PEPFAR Eswatini is proud to technically and financially support the Niema Client Literacy Campaign. This campaign enhances PEPFAR Eswatini's efforts to ensure the continuity of treatment for patients who are on ART. Significant interruptions in treatment are more likely to occur in the first year when someone has just started treatment, particularly for women aged 20 to 29 and men aged 25 to 39. We greatly appreciate the leadership of the Ministry of Health in partnering with program beneficiaries in these target age groups to develop messaging that directly addresses some of the major factors that are contributing to treatment interruption. Disclosure of HIV status to a partner, community stigma, and healthcare workers' attitudes. For the first time in history, we have all of the tools that we need to control the HIV epidemic in Eswatini. I think we need to reflect on it. We have everything that we need. We have treatment that is effective and prevents transmission and keeps a person healthy. We have PrEP to prevent people who are HIV negative, who are at risk from developing HIV. We have everything we need. We need to continue to work on the stigma that persists in communities, that stops people from being able to disclose their status, to be comfortable to test, to be on treatment. The tools that we have, and through research and many years, a lot of us have been working in this for a long time, We have everything, but we can't use the tools if the people that need to know about the tools don't know about it or don't know how to use them. Undetectable is untransmissible. U equals U. This can change the way that people see HIV, and people living with HIV may see themselves. It empowers people not only to get tested, but to take control of their health, with the ultimate goal being to maintain an undetectable viral load, live in good health, and prevent transmission. We need to continue to get the message out there that ART is not only good for you, but it's good for your partner. This health literacy campaign will empower patients and contribute to improvements in treatment adherence, help those return to care that have stopped taking treatment, and further reduce stigma that's in the community. Everyone who is living with HIV deserves access to accurate information about their health. This is a right, it's not a privilege. Everyone with HIV needs to have the information to take control of their health. This campaign is well aligned with PEPFAR's broader investments that support the government of the Kingdom of Eswatini to achieve and sustain epidemic control. And as Abikanya mentioned, where we're up to and where we've achieved in terms of reaching 95, 95, 95, but we all know that we're not done. We need to continue to offer high-quality, client-centered HIV services to people living with HIV and continue to rapidly reduce the number of new infections. We need to address the challenges also that the last year and a half have posed for all of us and have posed for the progress in our programming and what's happening in communities. We need to act quickly to ensure we don't see resurgence of HIV infections. PEPFAR Eswatini looks forward to continuing our financial and technical partnership as the campaign is implemented. Niyema, PEPFAR stands with and supports people living with HIV to stay on treatment, and we work towards eliminating stigma and discrimination in the communities. Siyabonga kakhulu.
Thank you very much, Shireen, for such beautiful and amazing remarks from PEPFAR. You are such an amazing partner we have on the ground in response for HIV. We recognize you in all dimensions, in the support you give the country, including many other things that it's a big story. So we totally acknowledge your remarks this morning. Siqhubeka nehlelo wakangwane sithatha lethuba siqhubeke now sithathola inkulumo letawethuba simenya sethu lesicavile lo ngesiko ke musha etiko letempilo kodwa ngakamethuli ndacela ukuthi kude umphathi wethu Deputy Director Public Health Margaret Joyce for few remarks and welcome the guest speaker today. Let's put our hands together as we come. It's a new one, man.
Thank you.
Yes.
Thank you very much, Program Director, the Director of Health Services in the Ministry of Health, Dr. Makagula, the PEPFAR Coordinator, Directors of international partners we work with, senior government officials from the ministry, and other partners, the media representatives. Good morning.
Morning.
I would like to pay a special greeting to the recipients of care. How many do we have in the room? Recipients of care. I didn't say which care, so we don't get care. Yes. We are all recipients of care at a point in time. Today, our focus is recipients of care in the HIV/AIDS package. And we are very excited to be here and at this stage to launch this campaign. I just recall in the 40 years of the response, Nasi treatment literacy, how exciting it was to be engaged. We simplify the jargon so that somebody who takes this care understands what's happening. It's a great milestone to be here, and I think it is just timely to revamp the focus on patient literacy. We want to congratulate all the partners that are working on that. So my job this morning is to introduce our keynote address, a speaker, the Director of Health Services. We would like to appreciate your availability, Director. We know there's a lot of things on your desk, but to come and just kickstart and officially commission the campaign, siyajabula kakhulu ngoba kusinike amandla ukuthi sitawukhona kubuyela etiko nasesikhona lesitholako la sisagijima ngale campaign. We appreciate your availability and would like to invite you to take the floor and send us to work with the SNAP team and the recipients of care. Thank you very much. Let's welcome the Director at the Commission.
Thank you very much, Program Director, Dr. Dlamini, the PEPFAR Coordinator, Baba Nature. You can't be talking about the HIV, Nature, and other implementing partners, our partners in the media, who would not have achieved what we have had it not been the good partnership we are having with the media, and the recipients of care. Can we give them a round of applause? Distinguished ladies and gentlemen, I can't forget and not mention the directorate team, which is running around not only on the other issues, which I don't want to mention at the moment, but mentioning HIV. HIV is still a problem. It is still there. Yes, we have reached in 1990, which I'll be talking about in a few minutes, but HIV is still a killer if you're not using it properly. Ladies and gentlemen, good morning, Sanborani. The government of the Kingdom of Eswatini, through the Ministry of Health, has provided enormous support in the implementation of the HIV program activities in attaining of its goal, which is an HIV-free generation. The government and, of course, our donors have over the years committed themselves to procuring the life-saving antiretrovirals for people living with HIV in the country. Last year in September, the country was amongst the first to announce a great achievement of reaching UNAIDS 1990, which we have heard about several times. However, upon further analysis, as Babe Kanya said, well, Babe Mabuza, not Kanya. I can call him Kanya because he's younger than me, so don't worry about it. But as he has said that we did notice that, however, on further analysis, the Minister of Health realized that some groups are still lagging behind in accessing HIV services. The COVID-19 pandemic has not made it easy for the country to maintain these gains that were already achieved over the years. The problem identified a drop in the number of people taking their treatment, which can be associated with difficulty in disclosure, as well as community stigma, and of course discrimination. With funding from PEPFAR, through the CDC, that is the Center for Disease Control, implementing partners supported the Ministry of Health to develop what we are launching today, a patient literacy campaign, which we call I Stand. MBABANE, which seeks to address disclosure and community stigma and discrimination. The statement I Stand, can be owned by the public, by families, and the community members at large to support adherence to ART for people living with HIV. With that said, on behalf of the government, I would like to profoundly praise PEPFAR and the full array of government offices, starting with the Directorate, for their unwavering commitment to leadership necessary to bring about control of the HIV epidemic. I extend the government's thanks to the implementing partners, which includes the media, for their tireless work to support the programs and the people of Eswatini in preventing HIV and those with HIV to live long, productive lives. I also offer the government's deep gratitude and the respect to the everyday heroes, either affected or infected by HIV, who advocate for and inspire others, who offer a shoulder to lean on to the relative, to the friend, or even the neighbor, and who help to reduce stigma by talking about HIV. These are all the true servant leaders of this country. The government of Eswatini stand with all people living with HIV. Hulumende uma nabo bonke lebaphila ne-HIV Eswatini. I stand with my brothers, my sisters, my colleagues, my family living with HIV. The I Stand campaign will roll out in all the regions, in all the Ngunda, in all the communities, and I would like to urge all of us to stand with people living with HIV. I thank you. See a politician. Thank you, but I was mixing deliberately because I didn't want this to stand again. But I'll just summarize for the sake of all of us in here that sitelapha singurhulumende sinekusitwa ngeMamelika ngenza ba HIV and AIDS. Angiqale ngokusho ukuthi HIV akapheli. Siyathi ukuthi kuyasigijimisa kangakanani ngakho konke. Ayapheli just because sesikhuluma nge-COVID, each time ngisuma ngikhuluma most of the times ngikhuluma nge-COVID akusho ukuthi i-HIV ayisekho. Sike sa-achieve-a ke into eziningi ngekusitwa ama-partners, ngekusitwa nguhulumende etiko letempilo. Sakhuluma ngayo 1990 ukuthi ngisho sonke siyakhumbula ukuthi ukuthini, but lesi kunothisile kunokuthi nasi-analyze kukhona lokwehlayehla ebantu kulawo thatha lama-drugs. And nangabe sehla phela sesibuyela emuva sekuba inkinga. Ngiko-ke mende nama-partners akhe uqhamuka nalo kulesitokulonja namhlanje sekubithe ngokuthi ngima nezihlobo tami nabantu engisebenza nabo wonke umuntu lophethwe i-HIV sesithi asime selesho ukuthi siyalilungisa. Sidayilonja lena yonke indzawo ifike wonke enkundleni, ifike kuma-regions, ifike nama-communities. And ngicela ukuthi sonke asime nebantu lebaphathelene nabo utosuka phela le-stigma lethi banganisana kuloko sikhulume ngayo le-HIV singakhohlwa, notwithstanding inkinga lesinato the-COVID. I will be lying if I don't mention anything on COVID. Siyabonga.
Siyema. Thank you very much, Mthombeni. Inkulumo lezo tsena kangaka. Selitiko siyadiqhenya ngawe ngokuthi ube nathi kulomsebenzi welive lomkhulu kangaka ekulweni nesifo se-HIV. We'll take this time and appreciate a beautiful message from the Director of Health Services. As our guest today, it has touched critical areas in terms of the content. So on that note, colleagues, ladies and gentlemen, That was an amazing message. So this figure at Teneni, we're almost at the end. As we close, colleagues, according to the program, there are some few remarks to make. First remarks to make, it is in total appreciation of all the support that you've got for this initiative to be a success today, as Minister of Health, particularly the INEP, ESWATINI National AIDS Program. The support we got from CDC, through also co-work, under the Department of FCI, also from PSI, who have just really came up with a beautiful, strategic, and also well-designed labelings and all kind of beauty that you see that is being projected here. Without such kind of support, ngaphandle kokusekeleka kangaka, siyadumisa, siyabonga, so much that sitikulo tembilo siyatiqhenya ngayo. Sengivala nje ngidawuthi bongosi masotakithi. Sibonga sidumise nomsebenzi wokuthi njoba lo mdzala etikulo tembilo bayamakakula sekawusukumisile lo msebenzi ngalokhu semthethweni. Already the campaign has been officially commissioned. It has been officially commissioned, and what does it mean to us? Praise God. Praise God. Shokuthi asitheleke emasimini siyosebenza. Umloyo umuntu akabambe yakhe inzima usetshenzwe ngetigaba. From coordination, administration, implementation, down to the ground. Sisebenze ngetigaba tethu. Higher offices, SOPs, all kind of write-ups. Lokunyata lo msebenzi ngoba umsebenzi osukunyiswe ngoba siyawudzinga. And isikhathi ukuthi nawusentshetwa kube khona umphumela. So next year by this time we should speak a harvest from this kind of a campaign. So nayo kwindzaba yethu lesitawuphuma siye nayo emakhaya sisahamba saye ema-ofisini, ukuthi let's do something as far as the patient literacy that has been launched today. It should not something that remains here and we say we had a launch and so it is. So, and everybody is involved here as we go. And thank you very much to the media houses to cover up this session. And we believe it's going to go a long way. So with those words, siyabonga kakhulu and umsebenzi sosekugcineni. Ngidacela ukuthi sesivala la ngephandle kunemali. There is something refreshment to enjoy. And also let's maintain our social distancing. And as we go, can I pray in closure? God in heaven, we thank you this morning for this beautiful session, Lord. It is only a man who can plan, but it's only you, Jesus, who make it to come to pass. We thank you for all the effort, strategies that have been implemented for the success of this event. And as we go to our different offices, bless us and give us a beautiful day. In Jesus' name we pray. Amen. Sebo.
Asibonga Nkosi. Siyaphuma ihlelo ngicabanga ukuthi sitawukhuluma kafishane nje ngosonke ungambaleki. Sibonga kakhulu bakangwane njengoba senibonile ke umsebenzi ufike emaphethelweni ngekuhamba kwawo. Tinkulumo tichubekile solo ke abantu labadzala baveta lapha ukuthi umkhankaso uyasukuma eMaswati akasukume onke emenabo bonke labo labaphila nale sifo se-HIV njengoba sengathi lo mhla ile focus beyithi ayiconze khona kepha ke inhlelo tetempilo tibandi bekunene. We also appreciate our online viewers, those who are watching us online. We appreciate that you were able to follow through in everything that was happening here in all the programs. I have Mr. Advocate Dlamini, Dr. Advocate Dlamini here, who will just recap everything that just happened, viewers at home. Yeah, babangwane cha ngitawo kuba naye Dr. Ngwamemedela Nkosi.
Sicela nje lebazala bethu we request our senior to come for a formal photo.
Nyalo nje beka Nkosi siyabona lapha abantu abadzala balungiselela sona sithombe kepha ke Nkosi kuvala nje emave kuvala nangumsebenzi siyabona sofika emaphethelweni.
Asibonge kakhulu umsakati siphindze futhi sivusele kuwo umbukeli walo i-channel Yemaswati channel S used to be set so. Sibonga kakhulu kwakuthi sitosebenta kanye kulomsebenzi welive lesobita nge-patient literacy campaign that has been commissioned today. Lesi wethule namhla noma lwethule namhla ngalokusemthethweni ngilo sebenta that is Director of Health Services etiko letempilo. Lokho kumsebenzi lesiboko ukuthi usinikete amandla ekusebenteni tindzaba te-HIV even lonke nawo wonke lotsinzekayo in the HIV response kwakuthi sinemkhakha lomusha lekufuna sigijime nawo ukuqinisa budlelwane nekwesekela abantu labaphila nalabadla amaphilisi HIV kwakuthi kusukela namhla tindzaba ukuthi baqwayeke tindzaba ukuthi bativele babodvana kulolu hambo sithi namhla bayesekeleka ngalokusemthethweni and tinvetfana leto sitibeka eceleni kokuthi sifisa kuhamba nabo njoba sicubulo salomsebenzi sithi ngiyema lokusho ukuthi ngima naye lowo lutholakale ukuthi isimo sakhe sengadi sine HIV noma udle amaphilisi ngokuthi ngiyamesekela uyingcenye yami futhi siphila naye ulilunga lemndeni njengoba siphila naye so kubheka embili sigathe ukuthi ke litiko letempilo netisebenti talo tonke nje netotinini tengosi our implementing partners on the ground kwakuthi sente konke lokufanele sikwentiwe mathulusi ekusebenta alungiselwe ukuthi lo mlayito lona noma lo msebenzi lona usebenteke ngetigaba tawo tonke etindzaweni ngekushiyana in health facilities kwakuthi sitawubhala ama-SOPs sitawubhala and all kind of memos to make everyone aware ukuthi this is what we're supposed to do going forward. Lokho ke kutasisita ukuthi kube khona lokuthite lesikhona kubuya nako some few things to achieve sikholoka ukuthi tinombolo tethu titawusimama ngemkhakha yonke kufaka ekhasina labasha bethu adolescents and young women nabo ke futhi besilisa beminyaka lengemashumi lamabili nakune kweminyaka lengemashumi lamathathu nesihlanu kokuthi nabo batawukhuthateka so kusukela namhlanje sithi sema nawo wonke umuntu nelive lakithi ke lonke nje bashito Director of Health Service kokuthi live lakithi lonke liyema nawo wonke umuntu lodle amaphilisi noma lonesifo se-HIV so umsebenzi ume ngaleyo ndlela besinetimenywa ke lecavile letivela kubo bonke labasekelayo silive takhumbula ukuthi live lakithi lesekelwa ngibo tikhwama letivela ka PEPFAR nabo ke bayethulile inkulumo kudumisa umsebenzi nebudlelwane labanalo nelive lakithi ukuthi umsebenzi muhle kanganani lesebenta ngawo sisasebenta ukubhekana nomkhuhlane nekufaka ekhasi ukuthi live lasukumisa lihhovisi la nature nalo simbonile babe mabuza naye futhi afaka lakhe igalelo ukuthi nakaloku sisebenta kangaka ama-targets sekentiwe abo 95 kodwa ke akusho ukuthi sesifike egcineni kusenetikhale kufuna tisentshetu libona ukuthi tawufika 2030 vele sekwenzaba libona ukuthi sisebente ngetigabadayo ngalokufanele nekwegcina ukuthi umuntu asho ukuthi nabo ke be-recipient of care sho ukuthi labo ke lewo mbona bathola lolu sitho direct nabo basukumile batibongela ukuthi solo waqala lo msebenzi ukulwa ne-HIV nabo basebenzi basekhasi badlala amaphilisi bawubonile kwesekeleka ngathi tonke tigaba dumisa futhi batimisele ukusebenzisana netiko letempilo kuyembili. Angibonge kakhulu umsakade.
Sibonga kakhulu Nkosi sithemba ukuthi ilanga leyo balihle.
Sibonga kakhulu nako umsakato. Mvusele Ndvulini babe chawe.
Awunimbala sithemba ukuthi uvile Ndvulini njengoba umlangeni lapha avusele ngiyo umsebenzi wekuphakanyiswa komkhankaso Maswati lamahle lo bukeko nakukhuthata sona sive kuthatha yona imithi benkosi sengidawuphinza futhi ngisacubeka nje nginitawo ngena na babe yende lokuchamuka kiyo Elizabeth Glazer it's Patriotic Foundation nele bekayingcinye lo msebenzi babe yendeke besinaye emhlanganweni webetindzaba noma ke wemisakato nje yonke even kukhulumisa ukuthi phela kubonakala ngazuthi abantu abafuna ukuyithatha kahle lemithi sekuyakhulumisana ke nalomkhankaso losungiswa lomhla babeyende sikwamukele emsakatweni channel Yemaswati kutethula nje kafishane nekuveta nje ukuthi nithokoza kanganani ngalohlelo lomhla.
Siyabonga kakhulu Linda, sibonge nasemsakatweni we-channel Yemaswati, sivusele nasesiveni sonke seMaswati. Liqinisa lithi sithokoza kakhulu thina siyinhlangano ka Elizabeth Glazer Patriotic Foundation kuba ingcenye yalomsebenzi lofana nalona kuleli vela kaNgwane. Ikakhulu kati ngoba vele sisebenza nabo labo labaphila nalo ligciwane le-HIV emimangweni la sisebenzela khona nasemitholampilo la sisebenzela khona ngokusitwa inhlangano yamamelika bo PEPFAR nabo USAID kwenda lo msebenzi lo. Siyakholelwa ke thina ukuthi uma ngabe bantu bafundziseke kahle kutawukhonakala lokho ukuthi letindzaba tekunatha emaphilisi neku stigma ne discrimination noma lokubandlulula kubandlululeka kwabantu abaphila nalo ligciwane le-HIV kungabi lokukhona emimangweni ngoba batabe sebafundzisekile bantu sitawusekela la sisebenzela khona sente ukuthi bonke abantu bati lokho ukuthi kumcoka kuma naloyo lophila nalo ligciwane le-HIV kungaba kufamily kungaba kusemangweni kungaba nasemsebenzini la usebenza khona. It is very important to stand with that person who is living with HIV.
Sibonga kakhulu babeyende sithemba ukuthi lokhu nani kuyawunendela umsebenzi wenu ube malula nalo ningakukhuthaza ngako sive mhlambe senapha.
Sithemba kakhulu ukuthi vele kutasendela ukuthi umsebenzi wethu ube malula ikakhulu kati etindzabeni ukuthi batabe sebafundisikile ngoba njengoba ngiveta nje lokho ukuthi sisebenza kakhulu nalama adolescents nebantwana labaphila nalo ligciwane le-HIV nasebafundisekile kahle batawukhona kunatha kahle amaphilisi abo ngendlela lefanele khonakala ukuthi bavikeleke futhi nasekubandlululekeni etindzabeni te-HIV. Singakhuthaza nje kuso sonke sive ukuthi asichubeke sime nabo labo bantwana labaphila nalo ligciwane le-HIV nema adolescents laphila neligciwane le-HIV nawo wonke nje lophila neligciwane le-HIV kudele bativele bayingcenye yethu njengelive kuvetiwe lana ukuthi while we have been able to achieve gains latsite kulweni neligciwane le-HIV eSwatini kukhona lokunye lokuseselele kufanele ukuthi sikwende and le campaign lena ke ingilenye indlela yokuthi sigcine sesikwende konke sigcinele lokho ukuthi siku attain naloko lebe lokho kuseselele ngemuva ukuthi sikuzuze ekulweni neligciwane le-HIV eSwatini.
Siyabonga kakhulu Mr. Yende.
Siyabonga kakhulu.
That was Mr. Yende from the Elizabeth Glazer and its Patriotic Foundation unpacking what his reaction on the launch of this campaign. Maswati lamahle kulesikhathi ngiyathemba ukuthi njengoba lihlelo selibuye emaphethelweni kube ngumsebenzi lohambe kahle emakhaya njengoba besinethulela wona bukhoma usakada la Hilton Garden Inn MBABANE lapho bangwane besicubeka khona ke na ukuthula lihlelo sebe ukuthi niyabona isuku lelihle Maswati lamahle kusile bangwane. Bengosi sicubeka ke nawo kuthula inkulumo la sinayo umlomsala lapha umlangeni babe muhle Dlamini sikwamukele inkosi nako lapha sibona eMaswati solo ke eMaswati athamele inkosi eMaswati continue to watch here as we bring them every information about the launch of this campaign. Can you please maybe present yourself to the viewers, our online viewers, and those who are watching at home, and tell us about your excitement about the launch of this event?
Thank you very much. As PSI country representative, we are so excited to be part of and under the leadership of the Ministry of Health to support this campaign, from identifying the barriers for treatment adherence and barriers and knowledge gaps around patient literacy, then prioritizing those barriers and deciding which ones to prioritize and come up with such wonderful campaign themes like I stand, we stand, to the level a person living with HIV/AIDS will say I stand. The family members, peer support, friends will say I support this campaign. So under the PEPFAR support, we have been able to design and implement this campaign. So the excitement is we're at the verge of starting implementing such wonderful campaign in collaboration with Ministry of Health and other implementing partners. Thank you.
A word of encouragement to Yemaswati. We know that we've been overwhelmed by COVID-19. Maybe some people have started to forget about HIV. What can you say in that regard?
Yeah, let's get all of us committed towards maintaining the gains we have achieved so far. Yemaswati has achieved the 95-95-95 goals. So with this setback on the side of COVID-19, how do we really strengthen the partnership and towards like maintaining the gains? So let's get committed to create an environment where it's stigma-free and very supportive environment towards adhering to treatment and continue service uptakes.
Thank you so much.
Thank you very much. Nice to meet you.
Representative of PSI, we understand that we have many stakeholders here in the room. We will now speak to Dr. Buthelezi, who was also part of the launch. Dr. nani ningcenye lenkulu even kwesekeleni tinhlelo lekubonakala ukuthi tikuthatha kuphila i7. Can you just please share your reactions a bit on the issues of HIV and the campaign that was launched today?
Thank you very much, Mr. Shongwe. This campaign came at the right time. At the time where we were so confused because of COVID-19, but we also want to make sure that we sustain our gains of HIV. So this is a reminder that we don't have COVID-19 only, but we also have HIV as a disease. And we just want to remind those who are getting treatment and those who have tested positive to make sure that they do proper adherence to treatment and take their medication. It doesn't mean because we have COVID-19, we have to forget about the other diseases. And we know as a country we have reached 95, 95, 95, and we're moving towards 100, 100, 100. So we need that 5% of the population to be well targeted. And we're so excited that we're including even people who are living with HIV/AIDS, especially the young ones who have not seen someone with AIDS. So we want to make sure that we don't go back to the era where we're having people dying because of HIV/AIDS. So this is an opportune time to remind the public, Yemaswati, to say HIV is still an infection that can be prevented.
Thank you so much, Doctor.
You're welcome.
Udokotela Buthelezi naye asithulela ke my reactions akhe towards the launch of lo msebenzi walomuhla njengoba sathi ke bengosi ukuthi live leMaswati libalelwa kulelo live libonakala ukuthi lente kahle esigabeni sekulwa noma ke kuhlangabetana nemigomo lebekiwe ya mhlabhlangene sisheshe sihlangabetana nayo ke thine kangwane kepha ke lokho akusho ukuthi kufanele ke bese sesiyayekelela nje kufanele ukuthi sichubeke sinyuse emasokisi. We are one country that has done better in the issues of meeting the United Nations standards or the agenda that has been set by the United Nations. We have been able to achieve the 95-95 goal as ESWATINI, as it is benchmarked by the United Nations. to continue to eliminate HIV so that we can bring it to zero. But we are doing well as Eswatini, and we are encouraged to continue putting more efforts in the fight against HIV. Thus, this is part of those efforts. We continue to witness the elders being present here in the room, but we hope that our interviews have come to an end. We appreciate our online viewers as well. We bring this program to an end, and that is all. Viewers at home, I'm being notified by my TX producer here that we're still missing an interview here. We will welcome one of our guests who are part of the launch to give us their remarks as we continue here at the launch of the patient literacy campaign. Yes, siyabonga kakhulu Maswati lamahle. Solo ninathi lapha semukela nje tinkulumo kafishane kulabo lebe bayingcenye yalomsebenzi benkosi. Welcome make sina make Phumzile Mndzebele la lo tawutetfula achubekeke nekuveta ukuthi as we continue as a country to continue in the fight against HIV, what is really exciting you about the launch of today's campaign?
Asinibingelele Maswati lamahle, amake Phumzile Mndzebele. So what is exciting about today's launch is that we'll be going out there in the communities where we'll be teaching our clients about the benefits of taking ART and also the benefits of disclosing your status and the need for taking your treatment. Yes.
So in the fight against HIV, I think you've been to the communities. What can you ask from the people there to maybe assist you so that your work can be seamless?
Okay, maybe as we are in the communities, what we can ask from them is that if people can come to us and ask really about the treatment, what it is to take treatment, what are the benefits, and how can you stay long on treatment?
Thank you so much. Babukele emakhaya nivile ke uyeta make Mndzebele lapho emakhaya uthi utabe atokhulumisana nani ngabandi nekuchubeke timfundiso yini lenye lengakubuti yona mhlambe lofise kuyikhulumisana naye mbukele ekhaya ngalokuphakanyiswa kwalomsebenzi.
Ezisiphakamisa lo msebenzi siyacela nje ukuthi njengaloku lesicubulo sithi ngiyema ngiloyo akeme nemngani wakhe nefamily necommunity sibambisane ukuthi sichubeke silwe naleli gciwane labo lasebanatha lamaphilisi asibabambise so that wonke umuntu akhone kuphila kahle.
Siyabonga kakhulu.
Siyabonga.
Benkosi sithemba ukuthi njengoba sekuhambe kahle kanje siyaveleke tinzambo tethu sitibeke phansi kulesikhathi kubonakala ukuthi sichubeka kunethulele inhlelo njengoba sekusile Maswati lamahle. Ngilinda shongwe ke le sakuvalelisa lapha ehlelweni njengoba kubonakala ukuthi cha cishe konke sekuhambe kahle lona mkhankaso uhlose kuchubeka ukuthatha wona eMaswati ukuthi khumbule kukhulumisa tinhlelo letibonakalisa ukuthi tiyachubeka ke nekusita sona sive njengoba eMaswati lamaningi abonakala ukuthi kuvikela lo msebenzi kubaluleke kakhulu ekutheni siMaswati sichubeke sivikelane sonke. Lingako ke lihlelo benkosi ngiyalibeka lapho sithembe ukuthi sinithokodile emakhaya.